Yeah.
We are going to take questions at the end of the session, and I will be calling my next speaker now. Her name's Madhuri Raja. Many people might know her already. She is a nephrology grid trainee. She is an international trainee because she is from Sri Lanka originally, but she did her graduation in UK from Birmingham. But she has done all her research work outside of UK, which makes her unique in a way. She is going to be presenting here now. Thank you so much for coming, Madhuri. She's on her night shift, so she won't stay for long. And I will share her email address with anyone who would like to ask her more questions afterwards.
Hi everyone, good evening. Can everyone see my screen?
Yes, Madhuri, we can.
Perfect. So my talk is slightly different, so I will tell you that. One thing I want to say is that everything that all of the other specialty trainees have told you is exactly the same for nephrology. So you would basically do all of those things in terms of interview preparation, and there's a lot of information on the RCPCH website. It's generic for all specialties, especially the first part. So so all of those are applicable. So I don't want to repeat myself. So I'll tell you what I did, which is slightly different. And I think the reason that I think it's important that you all kind of are open to subspecialty training is because you bring in something very different, something that I seeked out and went out of the UK for, that you already have, and it's so important. So this is basically a timeline of what I did, essentially. So I trained in the UK as he said, so I went F1, F2, SD1, SD2, I did a pediatric nephrology SHO post, and I loved it. And at that point, there was some opportunity to do some transplant work in Sri Lanka to set up help set up transplant program and some research, and I fell into that. And so I took an out of program year between SD4 and 5. So that was my first out of program year. And then I came back and did SD5, applied for nephrology. And then I did another out of program year, did a global child health masters between SD6 and 7. And now I'm in my last 12 months. But this comes with a price, right? So that's why I say this is all about the journey, and it's not the destination. So during this time, these are all the different places I was in. So you sort of, if you want to do something like this, you would have to be ready to move, especially geography is restricting with all grid applications. It's a national application. There are ways to try to get the geography you want, but this could be tricky. So it's just something to bear in mind, but it's not a limiting factor, and it really does make things, I mean, the more centers you train in, the more places you train in, which again is a plus for all IMG trainees, because you've already been in a different place and you've already got experience that most UK trainees don't have. So this is just a quick, so this applies for not just out of program years, research projects, QIs, teaching, whatever it is, that extra bits that you want to do, whatever, or grid itself, whether to apply, these little points sort of apply to all of them. I would stress that you discuss it early. So even if you're not really sure, like I wasn't really sure in SD2, I was like, I'm not really sure. But that's why I took a year out and I did something in pediatric nephrology to see if I actually liked the specialty, or was it just the people I worked with in SD2? So you never know. So you have to explore it, and you can explore it early. The earlier, the better. Talk to people. Talk to as many people as you can, and if projects come along and lots of people like keen trainees, so you will get lots of projects. If you say, I want to do neonatology or nephrology, people will give you lots of work. But if it's not right for you and it's not your interest, then don't do it, and do whatever interests you, because that's what will make you stand out in any interview anywhere. So what are your strengths and what do you bring to the place? So that's really important. And everyone has different strengths, and we don't realize we don't all have to do the same thing, and that's the best part. So there's not a single pediatric nephrology trainee who's done global child health, for example, but that's what I'm interested in. So that's what I did. So you can make your training what you want it to be, and make it fit your interests and what you want from life as well as work. of course, they like taking time out also depends on your visa status and things. So just make sure that that's all, you know, sorted when you're taking your years out, because that can affect things and it limits a lot of people doing it. But it's still possible, especially like if you time it right, it's still possible. So there are a lot of things you can do out there. The opportunities are endless, honestly. So it's just something that you have to seek out what's right for you. I also want to go through some myths. So these are things that people generally tell, like trainees, other colleagues, people always have come and asked me, is this true? Is this true? So I thought I'll just bust some myths. So the fact that you won't get in if you're an international graduate, that's not true. There are many, as you can see, international graduates in subspecialty training from a long time ago. It's not even a new thing. Less diversity, that's also not true. Yeah, it's competitive, but also within reason. Less consultant jobs, that's also not true. There's a lot of, so the grid recruitment is based on the number of jobs available. So they put out jobs based on how many consultants they need in the NHS. So therefore, there are always jobs for someone. And especially if you want to do different things and you tailor your training to what you want, there's always jobs. And no, it definitely doesn't narrow your options. And then you definitely need a PhD or a research or higher degree. No, not in pediatric nephrology. You can be a very clinical pediatric nephrologist if that's what you want to do, and it's highly possible. So these are the realities. Yes. So I think personally, I think there are much better prospects for international graduates because you have experience that other conventional trainees don't have. So you may have worked in a particular center in your country, or have seen things in a low resource setting, or being able to adapt and work in settings that we don't know, because in the NHS we have quite a lot of, we're lush with resources, and that's really important. And those are your strengths, and those are the things that you have to focus on. And you may have networks and links with people abroad, and you can do projects with them. You don't always have to do a project here, which is another thing. You can, so all of the work I've done is not like, I've done some things in the UK, but it's, you can always have collaborations, and you will have networks. You will have your old supervisors or your old professors. It's really, those are things that only you have. And consultant jobs are increasing everywhere. Like I said, yeah, no, I don't think it is competitive. You do have to do some basic things like all of the other talks talked about. So you do have to do the basic, like application, you have to have X, Y, Z, yeah. But you can make it how you want. You can make sure that you bring out your best. It broadens your options. So something like pediatric nephrology it doesn't mean that you have to be a pediatric nephrologist. It like, that is the point of it. But say if you have other interests, there are lots of other options, like right from research to teaching, academic things, pharma, lots of things that come out from doing subspecialty training, and your CV becomes much more strong, I guess. And any prior experience is good. So this is the other thing I just wanted to mention. I don't know if there are people here who are like far down in terms of experience. Maybe you've already done, like, say, neonatology or even nephrology in another country. If you've done nephrology in another country for about 4 or 5 years, and then you've come here and you're ST 4 or 5, you can also consider CSER. And there are, I know consultants now who have gone through this process of trained in other countries and then converted their skills and are now practicing in the UK. So I wouldn't rule out any experience you've already had. And the ST 4, 5, 6, 7 pathway is not the only way. It's just another thing to mention. These are 2 really important places that you can get lots of information. So pediatric nephrology, there's a lot of information on the RCPCH website, and RCPCH shape of training. I don't know how many of you have heard of it, but it's coming. It's like the GMC has basically asked that a lot of specialties revamp their training to recruit more and create more like consultants, and to kind of keep consultants in the UK because there's such a mass exodus. Shape of training essentially gives you options to even switch between specialties, which is something that a lot of trainees don't know yet. And it's not quite come to, it's not you can't do it right now, but I think from 2022, when this new Progress Plus comes into play, you would be, for example, if you applied for pediatric nephrology, you did 1 year and actually you thought, oh no, you know what, I'm not so into this, but I do really like rheumatology. When I was covering rheumatology on call, because a lot of the competencies are similar, for example, immunosuppression and rituximab, like they use quite a lot of the same things, and a lot of chronic disease, looking after long-term families, a lot of those competencies are quite similar. You can actually switch specialties if you've only done 1 year, which is an option that we didn't have. So it's just something to bear in mind, that going forward, there's lots more options. So it is really the journey and it's not the destination. I honestly believe that anyone can do anything that they want. There's also different ways to get there. So I know people who did teaching things as an extra out of program. I know people who did PhDs and then got into nephrology. I know, and I did I did 1 out of program year, not even in the UK. And there's lots of ways, and you don't have to do those things also. I know people who didn't do any of that and just did what you needed to do, SD4, SD5, you apply, and they had enough on their CV. But any extra thing that's different or anything that shows commitment to the specialty is always good. And if you do what you love, all of these other things are just side effects. You would automatically, if you went out and seeked out something you liked, you're automatically going to write something about it. You're going to do a project about it because you love it, and it's not hard. The destination may also change along the way, and that's okay. It's all about the process. And you can always you get dual accreditation with pediatric nephrology. So you do become a consultant pediatric nephrologist as well as a general pediatrician as well. So you can always then change your job later if you want to. There's never it's not like that's it, that's the destination. There's so many different options. And yeah, pediatric nephrology is great. If you want any information, if you're interested in applying, I would suggest just contact me directly, and I can put you in touch with different people, or I can help you with your applications, whatever. So it's much easier than trying to tell you exactly what to write or what to say at the interview. Thank you.
Thank you so much, Madhuri. Such an interesting presentation, a very different perspective to it, really. All the best for your night shift tonight.
Thank you. Thank you.
Thank you for your time, really. Thank you for your time.
Thank you. So I won't be there at the questions, but if anybody is interested, please, even if it's not about pediatric nephrology or anything, just contact me. Thank you.